Welcome back to another video. In today's Sunday special, I'm going to be interviewing a labor and delivery nurse who also happens to be my wife.
Hi guys, my name is Nicole. I graduated last year in May, so 2018, and I went right into postpartum nursing right after I graduated, and then I started labor and delivery last year at the end of the year and finished my program in February of this year. So I've been a labor and delivery nurse since February of 2019.
So how long did the training for labor and delivery take?
Well, here they offer a condensed program that's actually a 6-month training program, but I wanted to get ahead of the game while I was in nursing school and did all of the preparation courses ahead of time. So it was about 3 months of extra coursework, and then once I got into the training position, since I was done those courses, it was another 3 months of actual hands-on training. And
what do you like the most about practicing in labor and delivery?
I love the longer term relationships with patients. Like, I like that I'm not just running in and answering call bells and handing out meds. I'm actually interacting with people all day. So I really find by the end of each shift, it's almost like I've made like a new set of friends every single time, and you really build a strong connection with people.
Okay, so if somebody was thinking about labor and delivery and pursuing that avenue as a nurse, what would you recommend for them, or do you have any words of wisdom for them?
Labor and delivery is sort of comparable to emerge nursing in a way, just less sick people. So if you find yourself tickled by emergency nursing because you like the idea of an adrenaline rush and you never know what's coming through the door, labor and delivery is another alternative, just with healthy people, and it's usually a happy scenario. So for me, it's the best case scenario. I think labor and delivery also, like, it's very good for skill training. You don't really think of it that way. You usually think of medical floors for practicing your catheters and IVs and everything, but labor and delivery actually has allowed me to do a huge range of skills that I wouldn't have done otherwise.
I see.
Yeah.
So what makes you like labor and delivery so much that you want to do it every single day?
I think like the gratitude of people. You're really seeing, like, for a woman, this is usually the most pivotal moment of their lives, and the fact that I go to work and my job is to be there for this moment is such an honor. So for me, it's a big deal to go to work every day. I feel like I'm really actually making a difference. And
how is the patient load like? Do you often find that you're short-staffed? Is it very stressful? Explain more about that, and the complexities of the patients. Is there a wide range of complex patients you see, or what do you think?
In theory, usually, like, we should have one patient per nurse. It's supposed to be one-to-one patient care, but often that's not the case. It's like emerge, like I was saying, you can just not predict what's going to come through the door. Sometimes it's just way busier than that. There's also a lot of people that come into labor and delivery that aren't actually there to deliver a baby. There's just complications of pregnancy that we have to deal with all the time. And in terms of complexity of people, there's such a range. The area that we live in is a lot of older patients. It's an older demographic, and that comes with higher risk for childbearing. So there's a lot of women that come in with blood pressure or blood sugar issues, and just past the age of 35 makes things tougher anyway. So I'm dealing with quite acute situations pretty often, I would say.
And when you say older, what do you mean? Like, what age range do you mean by that?
35 and above is AMA, or advanced maternal age, so I'm dealing with an older population here of people just because it's a more career-driven area. So that for a childbearing, these are old patients, you know?
Okay, nice to know. And so...
so nice to know.
The other question I had was, what has been the hardest thing that you've had to overcome as a labor and delivery nurse?
I I think feeling like there is no structure to labor and delivery nursing. Other floors, I think it's quite methodical, your approach to your day. You come in, you check out your meds, you read up report, and then you can kind of systematically go throughout the day. Not to minimize, for sure, some things can go wrong anywhere that you're nursing, but with labor and delivery, it's often you're just thrown into a situation the second you get to work.
Leo's just going crazy.
And now I forget your question. What was it?
Oh, the question was what was the hardest thing for you that you had to overcome?
Oh yes, just being able to deal with like an ever-changing circumstance. There's no time for you to kind of plan out your day. It just isn't that type of nursing. It's very much critical thinking. You have to be able to problem solve. And for me, I think that was a bit anxiety inducing, because I think like a lot of newer grads, we like a black and white boxed answer as to what to expect with things, and you just can't. It is different with every patient.
I see. All right. Well, that's the end of this interview, guys. I hope you enjoyed it. If you want to see more videos like this, please consider subscribing and let me know in the comments below. What do you think? Would you like to hear more of Nicole and her experiences as a labor and delivery nurse? If you do, let us know. Other than that, see you next time in the next video.